Hello everyone, this is Suhan, Doctor of Physical Therapy. Do you have pain over this area? If you do, then this video is for you, so stay tuned. There are 3 conditions that will tell you if these treatments will work for you. First, your pain started when your foot was moving in extreme motion of your foot up or outward. Second, your foot downward motion is less than your other side and it is harder for you to bear weight. Third, you have positive tests on those 2 special testings. One is Kleiger's test. This test is performed by bending your knee to 90 degrees with your ankle in neutral position and applying an external rotational force. If you have pain or aggravation on medial side of your ankle, then it is tested positive. Another test is squeeze test. You can squeeze between your tibia and fibula bones, and if you have pain that is lower than where you squeeze, then it is tested positive. If you have all of these followings, you are suspecting to have high ankle sprain. High ankle sprain is a ligament sprain that is located on the area that connects your fibula and tibia bones that are just above your ankle joint. It is one of the 3 types of sprains. There are inversion, eversion, and high ankle sprains. Inversion sprain is the most common type that we see for ankle sprain, but high ankle sprain is a common injury that we see from playing sports. There are different grades for sprains. It varies from grade 1 to 3, and grade 3 indicates a complete torn of the ligament, so it'll lead to permanent instability. That requires a surgery for stabilizing the ankle joint. Grade 1 and 2 will be in the criteria where you may start with physical therapy sessions after immobilization without requiring a surgery. So I have 3 treatments that are recommended that I prepare, so here we go. First, avoid forceful external rotation and dorsiflexion of your ankle. As we explained earlier, forceful motions of rotating out or your foot moving upward is literally what caused the injury. We will still do exercises to restore your motions from immobilization of your joint, but those range of motions should be pain-free. So dorsiflexion with half kneeling is recommended. I want you to half kneel like this way, where you want to work on your dorsiflexion. And we're going to slowly bring your knee forward until you are at the end range of motion where you feel stretching. I want you to hold it for 5 and then bring it back. And we're going to try this one for 20 repetitions. Whenever you feel there's a little discomfort or a slight sharp pain, then you can always step backward. So you can do ankle inversion and eversion at home by using a ball or a folded pillow like this way. And we want to use the pillow right between your knees so that you cannot have any compensation during the movement. So I want you to bring your foot out this way while you're actually pushing each other, like activating your adductors. And then you should feel your muscles working over there. And then we're gonna try about 3 sets of 10 repetitions. And we can also do ankle inversion. Just like that way, for 3 sets of 10 repetitions. Second, restoring of your motion for plantar flexion and strengthening plantar flexor muscles are recommended. Your foot moving down is usually limited after this injury, so we want to do active range of motion for plantar flexion to restore the range of motion. When the motion reaches to 50 or higher, then we want to start strengthening exercises. So once after we achieve normal range of motion for plantar flexion, then we can progress the strengthening exercises by starting with sitting, heel raises and sitting, just like that way for about 30 times. And then progress your heel raises and standing, just like that way. And then even from that point, you can progress your exercises, eccentric heel raises, so raises and bring it down, bring it up, bring it down, bring it up, bring it down. Lastly, balance exercise is recommended. Once the ankle is damaged, especially if you had a brace or boot for healing, proprioception is decreased that reduces your balance ability. So in terms of your balance, our ultimate goal for your balance is gonna be for you to be able to hold for 30 seconds while you're standing with one foot. And not just standing one foot is important, we also want to maintain the proper position for your pelvis We don't want to see your pelvis leaning to the left nor right. We don't want to see your upper body is leaning backward nor forward too much. So when we try to do the proper way of standing, we usually struggle with properly activating your hip adductors. So the exercise that I'm about to introduce, this is a great way to practice your single leg standing while you're activating your hip adductors. So we want to use a ball and then place it over the wall like this, and then bring your leg all the way up to 90 degrees and like maintaining your pelvis, your upper body straight. I want you to push this leg against the ball while you're trying to activate your adductors. So when you are trying to lean on that side, it's gonna be much easier for you to activate your hip adductors. So I want you to hold this position for 30 seconds, and we're gonna try this one for 3 times on each side. So when you get comfortable with activating your hip adductors, then now we are progressing your exercise into single leg standing. And then try to maintain your upper body straight, trying to maintain your pelvis not leaning to one side than the other, and hold for 30 seconds, 3 times on each side. How was it? Hope this helps for improving your high ankle sprain. Thank you for watching. Bye-bye.